A CCMA is asked to schedule a patient for a fasting lipid panel. What instruction should be emphasized before the test? A. Drink only black coffee on the morning of the test. B. Avoid eating or drinking anything except water for 12 hours. C. Stop taking all prescribed medications for 24 hours. D. Arrive after a heavy breakfast for accurate results. Answer B. Fasting lipid panels require no food or caloric drinks for 8 to 12 hours, only water is permitted for accuracy. While assisting a provider with a wound culture, what is the most critical step for preventing contamination? A. Swabbing the outer skin before the wound bed. B. Wiping the swab across multiple sites. C. Storing the sample in a refrigerator. D. Using a sterile swab directly from the wound center. Answer D. Cultures must be collected directly from the wound center using sterile technique to prevent contamination. A patient on anticoagulant therapy presents with unexplained bruising. What should the CCMA do first? A. Immediately apply a cold compress. B. Report the finding to the provider. C. Document the bruising without informing anyone. D. Recommend the patient stop taking anticoagulants. Answer B. Unexpected bruising in anticoagulated patients may signal excessive bleeding risk. Notify the provider immediately. When collecting a urine specimen for culture and sensitivity, the CCMA should instruct the patient to provide which type of sample. A. 24-hour urine. B. Random urine. C. Clean catch midstream urine. D. First morning urine. Answer C. A clean catch midstream urine minimizes contamination, ensuring accurate culture results. During an EKG, the patient begins to experience chest pain. What should the CCMA do first? A. Continue the test until completion. B. Stop the test and notify the provider immediately. C. Ask the patient to relax and ignore the pain. D. Switch the leads to confirm placement. Answer B. Chest pain during an EKG may indicate acute cardiac distress. Stop immediately and notify the provider. Which of the following is a CLIA-waived test a CCMA may perform? A. Pap smear interpretation. B. Blood typing and crossmatch. C. Urine pregnancy test. D. Histopathology slide review. Answer C. CLIA-waived tests include simple, low-risk procedures such as urine pregnancy tests. Which vein is most commonly used for venipuncture in adult patients? A. Basilic vein. B. Cephalic vein. C. Median cubital vein. D. Femoral vein. Answer C. The median cubital vein is most accessible, stable, and has the lowest risk of complications. A patient reports feeling faint during venipuncture. What should the CCMA do first? A. Continue drawing to complete the test. B. Remove the needle and lower the patient's head. C. Call emergency services immediately. D. Apply a warm compress to the puncture site. Answer B. If a patient faints or feels faint, stop the procedure and place them in a safe position with head lowered. A CCMA notices a small tear in sterile gloves while assisting in a procedure. What is the correct action? A. Continue working unless blood exposure occurs. B. Change gloves immediately and resume sterile technique. C. Cover the tear with tape and continue. D. Double glove to avoid contamination. Answer B. Sterile technique requires intact gloves. Replace immediately to prevent contamination. Which of the following patient rights is part of HIPAA? A. Right to free medical care. B. Right to access and obtain a copy of their medical records. C. Right to refuse signing consent forms. D. Right to unlimited second opinions. Answer B. HIPAA guarantees patients the right to access and obtain copies of their health records. Which of the following injections should be given at a 90-degree angle? A. Intradermal. B. Subcutaneous. C. Intramuscular. D. Intravenous. Answer C. Intramuscular injections are delivered at 90 degrees to reach the muscle tissue effectively. Which tube color is used for coagulation studies such as PT and INR? A. Lavender. B. Blue. C. Green. D. Red. Answer B. Light blue tubes contain sodium citrate, which is required for coagulation studies. What is the best method for verifying patient identity before collecting blood? A. Ask them to state their full name and date of birth. B. Ask for their home address. C. Confirm with the patient's family. D. Verify only with wristband. Answer A. The safest practice is having the patient state their name and DOB, not just confirmation. A CCMA must mail a lab specimen to an outside lab. Which is most important? A. Labeling with patient's initials only. B. Using regular mailing envelopes. C. Mailing without refrigeration. D. Packaging the specimen in a leak-proof biohazard bag. Answer D. Specimens must be packaged in leak-proof biohazard bags per OSHA and DOT regulations. When documenting in an electronic health record (EHR), the CCMA should A. Enter information only after the patient leaves. B. Record accurate, timely entries immediately. C. Summarize without details. D. Use personal shorthand notes. Answer B. Documentation must be accurate, clear, and completed immediately to ensure continuity of care. A patient reports dizziness after a blood draw. The CCMA should first A. Lay the patient flat and apply a cold compress. B. Have the patient stand up quickly. C. Document the event but take no action. D. Give the patient water and sugar. Answer A. Dizziness may precede fainting. Laying the patient flat and monitoring them ensures safety. Which of the following must be included in a chain of custody specimen? A. Patient's family history. B. Provider's private notes. C. Documentation of each person handling the specimen. D. Consent for unrelated procedures. Answer C. Chain of custody requires strict documentation of every handler for legal and forensic validity. The proper needle gauge for intradermal injections is usually A. 18 gauge. B. 21 gauge. C. 25 to 27 gauge. D. 14 gauge. Answer C. Small gauge needles, 25 to 27, are used for intradermal injections to minimize tissue damage. Which of the following is a common error in blood pressure measurement? A. Using the wrong cuff size. B. Having the patient sit with feet flat on the floor. C. Allowing the patient to rest for 5 minutes. D. Positioning the arm at heart level. Answer A. Incorrect cuff size gives inaccurate readings. It must fit the patient's arm circumference. Which of the following best describes informed consent? A. Patient agrees without being told details. B. Patient signs a form under pressure. C. Provider explains risks, benefits, and alternatives, and patient agrees voluntarily. D. Family member makes all decisions for the patient. Answer C. Informed consent requires the provider to fully explain before the patient voluntarily agrees. A patient on anticoagulant therapy arrives for venipuncture. Which site is safest to select? A. Dorsal hand vein. B. Basilic vein. C. Median cubital vein. D. Femoral vein. Answer A. The dorsal hand vein is safest for venipuncture in anticoagulated patients because it is easier to compress and less likely to cause serious bleeding. A provider requests a trough level for an antibiotic. When should the medical assistant collect the specimen? A. 1 hour before the next dose. B. Immediately after the dose. C. Halfway between doses. D. Only during fasting hours. Answer A. Trough levels are measured right before the next dose to assess the lowest concentration of the drug in the bloodstream, ensuring therapeutic safety. Which of the following procedures requires written patient consent under HIPAA? A. Obtaining insurance details. B. Sending lab results to another provider. C. Recording vital signs. D. Faxing medication refill requests. Answer B. Sharing medical results with another provider outside the primary care setting requires written consent under HIPAA for patient privacy protection. Which of the following is the correct needle angle for subcutaneous injections? A. 10 to 15 degrees. B. 45 degrees. C. 90 degrees. D. 60 degrees. Answer B. Subcutaneous injections are administered at 45 degrees, unless using a short needle in obese patients where 90 degrees is acceptable. During CPR, which action by a medical assistant would be considered incorrect? A. Allowing full chest recoil between compressions. B. Compressing at least 2 inches in depth for adults. C. Performing 90 compressions per minute. D. Minimizing interruptions in compressions. Answer C. The correct rate is 100 to 120 compressions per minute. Performing only 90 reduces effectiveness of circulation. Which laboratory tube should be used for coagulation studies? A. Lavender top. B. Green top. C. Blue top. D. Red top. Answer C. The blue top tube contains sodium citrate, which preserves clotting factors and is required for PT, PTT, and INR testing. A patient is experiencing hypoglycemia. Which of the following is the most appropriate immediate action? A. Administering insulin. B. Providing a glucose tablet. C. Offering water. D. Taking a urine sample. Answer B. Hypoglycemia should be treated quickly with a fast-acting carbohydrate such as glucose tablets to restore normal blood sugar. Which of the following actions demonstrates a septic technique during minor surgery? A. Using alcohol swabs after donning sterile gloves. B. Touching the sterile drape with bare hands. C. Opening sterile instruments away from the body. D. Placing instruments on a non-sterile table. Answer C. Sterile packages should be opened away from the body to prevent contamination of the sterile field. Which of the following rhythms is considered a medical emergency? A. Normal sinus rhythm. B. Atrial fibrillation. C. Ventricular fibrillation. D. Sinus bradycardia. Answer C. Ventricular fibrillation is life-threatening and requires immediate defibrillation to prevent cardiac arrest. The correct response when a patient refuses a medical procedure is to A. Inform the patient that refusal is not allowed. B. Document the refusal and notify the provider. C. Proceed with the procedure anyway. D. Ask family members to overrule the decision. Answer B. Patient autonomy must be respected. The refusal must be documented and communicated to the provider. Which electrolyte imbalance is most associated with cardiac arrhythmias? A. Sodium. B. Potassium. C. Chloride. D. Calcium. Answer B. Abnormal potassium levels, hyperkalemia or hypokalemia, can lead to dangerous cardiac arrhythmias. Which of the following PPE should always be worn when assisting with venipuncture? A. Sterile gown. B. Gloves. C. Surgical mask. D. Face shield. Answer B. Gloves are required for any procedure involving potential contact with blood or bodily fluids. Which blood pressure reading indicates stage 2 hypertension? A. 120/80 mmHg. B. 138 to 88 mmHg. C. 146/92 mmHg. D. 160/100 mmHg. Answer D. Stage 2 hypertension is defined as systolic greater than or equal to 140 mm of mercury or diastolic greater than or equal to 90 mm of mercury. Which injection route requires aspiration before administration? A. Intradermal. B. Intramuscular. C. Subcutaneous. D. Intravenous. Answer B. Aspiration is done in intramuscular injections to ensure the needle is not in a blood vessel before injecting medication. The correct response when a patient faints during venipuncture is A. Continue collecting blood. B. Call security. C. Remove the needle and lower the patient's head. D. Splash cold water on the patient's face. Answer C. First, remove the needle to prevent injury, then lower the patient's head to restore blood flow to the brain. Which test requires the patient to fast for 8 to 12 hours? A. Complete blood count. B. Lipid panel. C. Urinalysis. D. Point/INR. Answer B. Lipid panel testing requires fasting to ensure accuracy of triglyceride and cholesterol levels. Which of the following is an OSHA requirement for sharps disposal? A. Place in regular trash bags. B. Place in labeled puncture-resistant containers. C. Recap before discarding. D. Store until full before replacing. Answer B. OSHA mandates that sharps be placed in designated puncture-resistant, labeled containers immediately after use. Which of the following terms refers to difficulty breathing? A. Dysuria. B. Dyspnea. C. Dysphagia. D. Diplopia. Answer B. Dyspnea refers to difficulty or labored breathing, often seen in respiratory and cardiac conditions. Which of the following is the most accurate method of temperature measurement? A. Oral. B. Axillary. C. Rectal. D. Tympanic. Answer C. Rectal temperatures are considered the most accurate because they closely reflect core body temperature. Which of the following is the correct chain of infection order? A. Reservoir infectious agent portal of entry transmission susceptible host. B. Infectious agent reservoir portal of exit transmission susceptible host portal of entry. C. Infectious agent reservoir transmission portal of entry susceptible host portal of exit. D. Reservoir susceptible host transmission infectious agent portal of exit portal of entry. Answer B. The chain of infection follows: infectious agent reservoir portal of exit mode of transmission portal of entry susceptible host. Which term means surgical removal of the gallbladder? A. Cholecystectomy. B. Nephrectomy. C. Appendectomy. D. Hepatectomy. Answer A. Chole equals bile, cyst equals sac, ectomy equals removal. Cholecystectomy is gallbladder removal. Which instrument is used to examine the ear canal and tympanic membrane? A. Laryngoscope. B. Ophthalmoscope. C. Otoscope. D. Endoscope. Answer C. An otoscope provides light and magnification to visualize the ear canal and eardrum. Which of the following is a normal respiratory rate for an adult? A. 10 breaths per minute. B. 16 breaths per minute. C. 26 breaths per minute. D. 32 breaths per minute. Answer B. Normal adult respiratory rate is 12 to 20 breaths per minute. Which tube is used for glucose tolerance testing? A. Gold top. B. Blue top. C. Lavender top. D. Gray top. Answer D. Gray top tubes contain sodium fluoride, which preserves glucose for accurate testing. A physician orders 0.5 g of medication. The vial label reads 250 mg per ml. How many ml should be administered? A. 1 milliliter. B. 2 milliliters. C. 3 milliliters. D. 0.5 milliliters. Answer B. 0.5 g equals 500 milligrams. Since 250 milligrams equals 1 milliliter, 500 milligrams equals 2 milliliters. Which lead is considered the ground electrode in a 12-lead ECG? A. Right arm. B. Left leg. C. Right leg. D. Left arm. Answer C. The right leg electrode serves as the ground to stabilize the ECG and prevent interference. Which of the following urinalysis findings indicates a possible urinary tract infection? A. High glucose. B. Positive nitrites. C. Low protein. D. High ketones. Answer B. Positive nitrites suggest bacterial presence, commonly seen in UTIs. Which document outlines the rights of patients receiving medical care? A. HIPAA Act. B. OSHA Standard. C. Patient's Bill of Rights. D. CLIA Regulation. Answer C. The Patient's Bill of Rights protects patients' rights regarding informed consent, privacy, and treatment decisions. Which body system is primarily assessed using the Snellen chart? A. Cardiovascular. B. Respiratory. C. Musculoskeletal. D. Visual. Answer D. The Snellen chart is used to measure visual acuity and assess eye health. A medical assistant must calculate a child's medication dosage using weight. Which formula is most appropriate? A. Clark's rule. B. Henderson-Hasselbalch equation. C. Fried's rule. D. Pythagoras theorem. Answer A. Clark's rule is a formula for pediatric medication dosages based on weight compared to average adult dose.